I like to, when my patient's on a cardiac monitor, I'm comparing these pulses with what I'm seeing on the monitor and paying attention to mechanical versus electrical. The popliteals. Posterior tibialis. Here again, good solid pulses, not feeling any threadiness, no bounding. They're regular, they're even, they're full to palpation. So, pulses are good. Now for the abdominal assessment. And we went ahead and did not do femorals, but she would be checked in this region. I'm not going to bear this lady for this assessment. Warm hands for abdominal assessment, warm stethoscope, always nice to your patient. We always want to auscultate first because we don't want to create bowel sounds by palpating first, moving stuff around. Starting over the right lower quadrant. Right upper quadrant. I'm actually hearing some good bowel sounds here, good active movements. I would expect to hear 5 to 30 tones every minute in each quadrant. As I look over the abdomen, it's flat, not sunken, not distended by any means. I note a couple of small papules here, round, equal in size, symmetrical. No other lesions, not seeing any masses, bullae. I do see a few striae down here on the lower abdomen. Normal for a woman of her age who has bared children. So nothing unusual there. The umbilicus is inverted, no bulges there, no discharge, nothing funky coming out of there. We'll now percuss the abdomen. And what I'm listening for here is tympany, and I'm hearing it rather well. So nice sounds over the abdomen. As we come down here, I want to come down from her chest. I'm hearing that hollowness of the chest. Now I'm hearing more solid. So I'm noting where my liver is. And I got my tympany, 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 tympany. Oh, solid. So, and then I start from the top, dullness, 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 solid. She actually has a pretty good line right there where her bra is, so we will mark that. Come back up from this side, and we'll mark that. Now simply take a measurement, and what we're measuring here is the borders of the liver, and we're looking at about 5.5 centimeters, which would be within normal limits for an adult. So we percussed over it, we measured it. Now we're going to come over and percuss over the spleen. And we're going to palpate to make sure we don't feel the spleen hanging out there, which I don't. I'm not feeling it. So we're good in that respect. I can feel her ribs throughout. There again, noticing the symmetricalness of her ribs, her abdomen. Now we'll go ahead and palpate right lower quadrant. Start off with some gentle palpation. Kind of warn our patient what we're doing. Ask them if they're feeling any pain when I push, when I let off. Palpate over the liver. Sometimes in my experience, especially dealing with that adult male population, heavy alcoholics, those who partake, you can actually feel the margins of the liver, almost not necessary to even measure them by any means. So abdomen soft. Any tenderness when I'm pushing?
No.
Okay. So now we're going to go ahead and do our kidney assessment. I want you to let me push down. And I can actually feel it. No pain when I'm pushing on your back there? Okay. Now for the other side. So, liver, spleen, kidneys, abdomen. Also, now we're going to listen for pulses throughout her abdomen. I'm going to go just off midline here on the left side with the bell of my diaphragm. I'm listening for her aorta. Takes a little bit of concentration because it is deep there. I'm not hearing any bruit, I'm hearing a solid pulse. Now listening over the renal arteries. Both sides. Listening over the iliacs. Here again, hearing a pulse, no bruit. Have to concentrate a little bit because you got to listen through the other side of all those bowel sounds. All right. If I'm not mistaken, this concludes my assessment of the respiratory system, chest and abdomen. Let me do a quick scan of the room because I forgot to do it in the middle of the video. I was moving pretty fast, starting with the mirror, swinging around my patient, and all the way through.